Welcome to this session on Introduction to Disability. I'm Dr. Sankalpa Satpathy. I'm an assistant professor at Institute of Public Health, Kalyani in West Bengal. What do you picture when you hear the word disability? Do you see someone in a wheelchair? Someone who cannot see or hear? Disability is all of these and then so much more. Disability is the experience of any condition that makes it more difficult for a person to do certain activities. It means that one has fundamental difficulty accomplishing things that others take for granted. In terms of an official definition, a person with disability means a person with long-term physical, mental, intellectual or sensory impairment which, in interaction with barriers, hinders his or her or their full and effective participation in society equally with others. To have a deeper understanding of the concept of disability, let us explore the terms impairments, activity limitations, and participation restrictions. Impairments are problems in the body function and structure, such as the loss of a limb, loss of vision, or loss of memory. Due to impairment, there may be an activity limitation. Difficulties an individual may have in executing activities. It may range from a slight to a severe deviation in terms of quality or quantity in executing the activity in a manner to the extent that is expected of people without the health condition. For example, difficulty in seeing, hearing, walking, problem solving. The activity limitation may lead to participation restrictions, that is, problems an individual may experience in involvement in life situations. For example, difficulty in working, engaging in social and recreational activities. Let us take an example. Loss of or restricted vision in the eyes of an individual, an impairment, leads to difficulty in seeing, an activity limitation, leading to difficulty seeing things on the blackboard in the college or moving around in the classroom or college, which prevents them from fully participating in the class. Consider another instance. An individual loses his or her leg, say due to an amputation or polio, leading to difficulty in walking, thus restricting the person's mobility, wherein the person will have difficulty walking to school or climbing stairs. So, disability is the loss or limitation of opportunities to take part in society on an equal level with others due to social and environmental barriers. Disabilities come in all shapes and sizes. Let us try to understand the various forms of disabilities. Disabilities can be physical in nature, for example, an inability to walk due to an amputation or muscular or neurological dysfunction, as in the case of polio. It can be sensory, as in blindness or deafness. It can be cognitive, for instance, brain damage or mental retardation, or it can be emotional or behavioral, such as ADHD. For reference, we can take the case of the character of Arthur Fleck in the 2019 film Joker by Todd Phillips. The character's laughing condition is attributed to pseudo-bulbar affect that's characterized by episodes of unsudden, uncontrollable, and inappropriate laughing or crying. Disabilities may be any one of the above or a combination of multiple factors. Disabilities can be present from birth, such as Down syndrome or cerebral palsy. They can be acquired over the lifetime due to injury, such as limb weakness after a traumatic brain injury or spinal cord injury. It can be associated with long-standing conditions such as due to diabetes, there is vision loss, nerve damage, or limb loss. Disability can be static, as in the case of the loss of a limb. It can be progressive, say in muscular dystrophy. The weakness of the muscles increases as the disease progresses. Or it can be intermittent, as in this case of multiple sclerosis. A disability may be readily visible. A person with paraplegia walking in a distinct manner, or a person with visual impairment with a white cane, or a person using a wheelchair. Also, disability can be invisible in nature. A non-visible disability is a disability or a health condition that is not immediately visible or obvious and can defy the stereotypes of what people might think people with disabilities look like. It is important to emphasize that even though the disability cannot be seen, it does not mean that it does not exist, as in the former example of Arthur Fleck. Some other examples are people with hearing impairment, people with autism, depression, PTSD, chronic pain, etc. We'll take up the importance of discussing disability in the next session. Do join us. Thank you and have a good day.